Like it or not, the senior and elderly population is vulnerable to negligence committed by medical professionals, nursing home and assisted living facilities, pharmaceutical and medical device companies, insurance companies, and everyday individuals and businesses. The Injured Senior Podcast is here to help. Steve Heisler is the creator of the National Injured Senior Law Center and has been advocating for seniors' rights for over 20 years. You have questions, and Steve Heisler has answers. This is the Injured Senior Podcast.
Hello, everyone. This is Steve Heisler, the CEO and founder of the National Injured Senior Law Center, coming to you from steamy Baltimore, Maryland. You are tuned into the Injured Senior Podcast, where we educate and discuss issues of importance to the injured senior and elderly population, as well as the children and loved ones of the injured senior and elderly population. I am your humble host. So just everybody on the planet has been impacted by COVID-19. Simply put, the coronavirus is a common virus that causes an infection in your nose, sinuses, or upper throat. COVID-19 can trigger a respiratory tract infection. It spreads mainly through person-to-person contact, and the infection, the COVID-19 infection, can range from mild to deadly. Now, according to AARP, more than 43,000 long-term care residents have died from COVID-19, representing 1/3 of the U.S. deaths from the coronavirus. And I tell you this because our senior and elderly population is bearing the brunt of this deadly virus. And this is happening to the senior and aging population primarily in long-term care settings. But infection control has actually been a problem in nursing homes and assisted living care facilities long before the coronavirus came along. So here today to talk to us about infection control problems in nursing homes and assisted living facilities is attorney Richard Mollot, the executive director of the Long-Term Care Community Coalition, or LTCC for short. The LTCC is a nonprofit, nonpartisan organization dedicated to improving care and quality of life for residents in nursing homes, assisted living, and other residential care settings through policy analysis and advocacy. And I can tell you, my friends, that it is a real treat to have Richard Mollot on this show. Richard, hello, and thank you for gracing us with your presence today. We're really happy. We're really happy to have you on. How you doing?
Stephen, thank you very much for inviting me on. I don't think anyone has given me such a nice introduction as that.
I like to get you nice and comfortable so we can have a great conversation. So before we get into the sad state of infection control in our long-term care settings, I just wanted to get your thoughts about how the long-term care industry has handled protecting our seniors and elderly from COVID-19 at this time. Your thoughts?
Yeah, I mean, it's something that I, of course, think about a lot in the work that we've been doing. And frankly, my concerns and, I've been growing over the past several months. And, looking back, this morning, I was actually really angry about it because, we know that nursing homes are not great places to live, generally speaking. We know that, care tends to be, pretty poor and living conditions aren't great. But I think that for most people, they were really shocked to see that, preventing infections was such a big issue, and the implications of not having enough staff on a regular basis, which most nursing homes don't provide sufficient staffing to meet their residents' needs, how that has greatly amplified the harm that residents have experienced, both directly due to COVID-19 and indirectly due to what we're seeing more and more over the past at least month and a half of just abject neglect and substandard care.
And you put it very succinctly that it already is not a wonderful place to be in the first place. What are your thoughts about where the industry is messed up as far as protecting its residents from COVID-19? I know you said that they're understaffed. You also see that a lot of times they're not checking the temperatures or vetting their staff or people that were coming in and out of there. Is that something else that concerns you?
Well, I mean that's definitely a good point. I think that well, one, we don't know for sure. We just have general ideas because the information about what's going on in nursing homes in so many ways is just so poor. So the Trump administration just started, as of earlier this month, May 8th, 2020, started requiring for the first time that nursing homes report the cases among residents, cases among staff, suspected cases, deaths, both related to COVID and non-related to COVID among residents and staff, as well as the availability of PPE and other necessary equipment for to deal with this pandemic. But we went, March and April without having any of that information recorded. So we really don't know. But we do know that, of course, there has been, as you said at the start, just a tremendous, frankly, horrifying impact on residents in nursing homes and in adult care facilities, and that the only people who've been coming in and out of those facilities since early March, when families and ombudsmen were blockaded, are the staff.
Right. And we're recording this in early June. And generally, as a nation, the coronavirus infections are trending downwards, but we just don't know what's going to happen come the fall and winter. So this is definitely something that I'm sure you'll be keeping your eyes on.
Oh, absolutely.
Yeah. So I want to put COVID-19 aside, and I want to ask you, what, in your opinion, is the state of infection control in nursing homes and long-term care settings at this time, prior to COVID-19? I do want to point out to our injured senior community that 400,000 residents die each year from healthcare associated infections, according to the CDC, and it's a little under 400,000. So what is, in your opinion, what is the state of infection control presently in the nursing home community?
Well, I think, leading up to COVID-19 and for years, we've known that inadequate infection control and prevention is a serious problem. It was last year the most cited deficiency in nursing homes. And what's particularly troubling about that, not to get too much into the weeds, but this is the kind of work that we do, is that when I review, and I don't review all of them, but when I have reviewed those citations over the years, they're almost always observational, meaning they're what the survey team saw in their annual survey when they're in a facility for approximately 3 to 5 days. So the nursing home, the state agencies, the State Department of Health, the Department of Public Health, they're responsible for ensuring that residents are safe and that facilities are providing adequate services, safety, et cetera, 24 hours a day, 7 days a week, 365 days of the year, not just for the 3 to 5 days that they're actually in the facility. And so what really troubles me is that those citations, at least all the ones I've read, and I've read thousands over the years, the ones for infection control and prevention are always, in my experience, what the surveyor actually saw. So states aren't doing a good job in making sure that nursing homes are fulfilling those requirements on an ongoing basis. And hence, that's why we have infection control and prevention being a major issue in terms of citations, as you said, deaths. I mean, when you consider that there are only 1.3 million nursing home residents, I think, about 1 million, maybe a little bit more, assisted living residents in the country. And of those, say, approximately 2 to 2.5 million people, there are 380,000 deaths resulting from infection. That is pretty astounding. And the other part of that CDC data that they cite is that there are between 1 to 3 million serious infections, their terminology, not mine, serious infections in nursing homes every year. And just lastly, if you are, as I'm sure you know, and probably your audience members do as well, that there is a lot of neglect, unfortunately, in nursing homes. So that's only the infections that nursing homes have actually acknowledged. I mean, how many times have we unfortunately seen residents who have become septic because they had an infection for days or weeks or sometimes even longer, the pressure ulcers, et cetera, that have been allowed to fester. All the, unfortunately, two common things that we see in nursing homes which don't go identified. So I think those are underestimates, and as horrible as they are.
That is scary. That's just really, really scary and very disturbing. So why do you believe that 1/4 or 1/5 of the nursing home and assisted living population are dying? Why is this happening? I mean, it's a disgrace. So why is it happening?
It is a disgrace. It's happening because, kind of what we've hinted at with how we have citations or have had citations for the major problem of infection control pre-COVID, just in the, over the last 10, 20 years, that the nursing homes are allowed to operate without providing good care, without having enough staffing. And a lot of this really comes down to probably, most of it comes down to staffing, especially when you talk about infection control and prevention. And that's the other thing that I find really enervating, to say the least, about the current situation and the deaths and the distress that it's caused, is that we're talking about hand washing. We're talking about changing your gloves if you had to help someone with toileting before you put in a feeding tube, or go out and leave the resident's room and start touching other things, other medical equipment, et cetera. That's how these things spread. It's not rocket science. It's not some special fancy thing that you have to be doing. It's just having the staff and having the staff trained so they're not taking shortcuts, that they're stopping to wash their hands. 20 seconds is what it takes, stopping to do that. And unfortunately, the nursing home industry has monetized the way nursing homes are operated, and corporatized is the way I think about it, is that they've become so much more corporate entities rather than facilities that had more of a connection to their communities. That it's money, and how do you save money? You cut back on staff.
Right. So are you saying that it's the lack of staff which is causing more infections, or it's just that the staff they're just indifferent and really don't care about proper sanitary, making sure that they're washing their hands and the like?
I think it's lack of staff. I think that that you certainly have bad apples in terms of care staff, but most people who go into a nursing home, we've done studies on this in the past, and others have, of course, as well. They want to do a good job, but the environment of the nursing home is so toxic, the working environment, that it makes it impossible. So residents are dehumanized, and to some extent care staff are also dehumanized. And so if you came in trying to provide good care, you can't. You get inculcated into the system that is, unfortunately, as I said, toxic.
So they're understaffed. Already they've got too many residents that they've got to look after, they got to care for. So if they're understaffed and they're short on time, they're going to cut as many corners as they can. And one of those, I guess, is hand washing, right?
Right. So, imagine, for you or others who have been in a nursing home, if you're caring for someone and then you have call bells and, maybe a pager that's ringing and, and something over the intercom, and you have to run out, that you would just be, rush. And you may not either think to do something the way it should be. You may not feel like you have time to stop and wash your hands. It's so indicative of the problems that we unfortunately see, every day, for those of us who are working on these issues, or frankly, who have loved ones in nursing homes, that residents don't get fed, residents don't have access to hydration, they're not turned, they don't receive help to go to the bathroom, so they wind up being diapered inappropriately. All of these things we just accept too often as part and parcel with the nursing home experience. And it's not what the standards call for. I mean, that's why we're here. I mean, it's because the standards are really good. They're just not implemented for residents.
So The federal nursing home reform law. I was on your website, and by the way, your website is fantastic.
Thank you.
And there are so many great resources for people that come to the site. So I highly recommend anybody who's listening to this to go. And I'm going to get your web address at the end of the show. We'll go ahead and get the contact information for you, as well as how to get to your website. But hasn't the federal nursing home law, the reform law, hasn't that helped, or hasn't that made the situation better? And maybe it's just an enforcement issue, or what about the new federal law?
Well, that's exactly right. So I will. The nursing home reform laws from 1987, and then regulations went into effect.
My apologies.
That's okay. In 91. So the standards have been around for quite some time, and the standards are really good. They were revised in 2016 to basically modernize them a little bit. I mean, we have a much better recognition now than we did in the late 80s, early 90s about what it means to grow old, or what it means to be a person living with with dementia, or with any other kind of physical chronic condition. We know that everyone is we treat people more humanely now and think of them more humanely than we did 30 plus years ago. But the regulations were actually one of the small changes that was important, that was made in 2016 to address this very issue of infection control and prevention, and facilities' longstanding failures to undertake appropriate protocols, is that nursing homes are required to have, on a part-time basis, an infection preventionist. But unfortunately, it just, if I may, that when the Trump administration came in, and we're not a partisan group, but they have been undertaking a lot of regulatory reduction, which in the nursing home world means reducing safety standards. And one of the things that they proposed is to actually reduce that requirement for having an infection preventionist on a part-time basis.
And we can see that this obviously is just exacerbating the problem. What about sterilization of equipment? Is that a problem in nursing homes?
Yes. So, I mean, a lot of the citations that we see, unfortunately, and when we see some of the legal cases, whether it be a private lawsuit or through a state attorney general's office, it is that the equipment is not been cleaned appropriately. Even equipment that is in contact with say a feeding tube or something else that is actually going into a resident's body. There's just getting back to what we were talking about, the standards. I mean, those standards are really good. They're just not enforced. I mean, the industry is extremely powerful in the state capitals and in Washington, D.C. So they fight against, enforcement. They fight even before the Trump administration. For many years, they have worked successfully to weaken enforcement. So we do have persistent issues of not only poor infection control and prevention in respect to washing hands, which is just so basic, but even just cleanliness, as you were saying, of some of the equipment. I mean, some of the citations that I read are just so horrifying and commonplace. It's not just it's an exceptional, but commonplace that we have really bad things happening, unfortunately, in nursing homes.
It's really unconscionable that the nursing home industry is fighting enforcement of safe and sanitary conditions. That to me is just mind-boggling. I can't really wrap my head around it. And I think you have very succinctly and definitely have highlighted the hand washing issues, and we just talked about sterilization. I just want to talk about one other issue as far as some of the problems that we're seeing in nursing homes. Why is there such a problem with linen control? Why can't residents get clean linen? And then this is apparently, from what I'm reading from your website, this is also causing infections.
Yeah, it's nursing homes. Again, I hate to say the same thing over and over again, but it gets back to the same problem. I mean, nursing homes have to provide a clean environment, and that's one thing that we've heard from people. They knew, as I said at the start, nursing homes aren't great places. But people who have been in touch with us have just shocked that nursing homes aren't clean environments, and that there is just this lack of sanitation that is so widespread. And so, nursing homes are really even though the rules are good, as I said, one problem is the lack of enforcement of those rules. But another issue, which is, I think, a really important part of this, is that there is virtually no accountability for how nursing homes spend the money that they receive to provide care. So, like, just to get at the linen issue, I mean, you can be a nursing home and you can own a laundry company, you can own a therapy services company, you can own the underlying property to your own nursing home and pay yourself whatever you want for those linen services, for the rent on the underlying property, for therapy services, etc. So there's so little accountability in every chain of what's going on here, both in terms of where's the money going, how it's being spent, and are they getting good services to ensure that the residents are getting good services. It's just an utter absence of both the regulatory enforcement of those safety standards, but even just the integrity of the Medicare and Medicaid programs that pay for most care to ensure that the money spent is actually going to clean the laundry, to for reasonable rent, etc.
Well said. Well said. And I'm gonna stop there about talking about what the problems are. I think you've definitely articulated very well as to what we're seeing there. Let me ask you this. So we know that the places are dirty and that people are getting infections and they're understaffed and the like. What are some of the most common infections that you're seeing in nursing homes and assisted living facilities?
That's a good question. I think that would honestly be hard to say. I'm trying to think in terms of the tracking. There's not a lot of good tracking there. There's something called, in the nursing home world, the minimum data set, which every resident is assessed on a range of different things. And it might say infection, it would certainly say pressure ulcers, which are not an infection in and of themselves, but can lead to infection. MRSA has been an issue. Normally, the influenza, which is not an infection, but it's related to obviously COVID-19. So there's not, frankly, at least to my knowledge, a lot of really solid information. But you raise also kind of a good issue, is that we have no information about this in the assisted living world, and that's been a real concern for me. Is that residents in assisted living who don't even even though the standards for nursing homes are not well enforced, there are virtually no standard. First of all, there are no federal safety standards for assisted living or for assisted living staff. It really comes down to the states, and we've done a lot of work on this nationally over the years. Most of the state standards are extremely low, and their enforcement is even worse than it is in the nursing home world.
That is really, truly hard to believe. But so, yeah, nursing homes are at least skilled nursing facilities, or you've got skilled employees there. I had Rob Schenk on a couple of episodes ago, and he said that the assisted living facility industry and the assisted living facility world is like the wild, wild west.
Yep.
So he says, as bad as things are in nursing homes, they are much worse in assisted living facilities. And is that what your organization has found?
Yes. I mean, I would say he's exactly right. It is the wild, wild west, and it really varies. So, I mean, you could have facilities that are good, that have an RN on staff, but most facilities don't. And if facility ownership changes, or they want to save money or cut back on costs, that RN who was there when you came in could be, when you signed the contract, could be gone. But the issue, as I see it, is that those facilities operate, as far as the state is concerned, kind of like a hotel, or just like an independent housing, when they're in fact providing more and more care services to people who have vulnerabilities and needs, especially with dementia and with aging, that are similar to those in nursing homes, but without any of those protections that we've been talking about.
So is infection control actually more or less pursued in or less effective in assisted living than it is in nursing homes?
Yeah, absolutely. I mean, and that's true pretty much for everything. I mean, the staffing requirements are different, as you said, there's skilled nurse staffing in nursing homes. You have to be at least a certified nurse aide to provide care in a nursing home. You could be, and that requires a minimum of 75 hours of training under federal regs. In assisted living, you could have 8 or 15 hours of training, and there'd be no RN. There may be no one who's even awake, 24 hours a day in the building to provide, to ensure that if a resident has a need, that he or she is cared for in some way.
And is the assisted living facility population growing? Are more elderly or seniors, aging population going into assisted living as opposed to nursing homes, or what are the trends there?
Yeah, the trends are that they are growing. And most states, I think 48 states now, have some kind of Medicaid assisted living program to enable people who are on Medicaid avoid a nursing home placement and go into assisted living. It's considered like a home community-based service. So yeah, we are seeing growth there, but we're not seeing what should really follow, which is ensuring that care is safe and appropriate for those residents.
So if you're a resident of a long-term care facility, such as a nursing home, assisted living, what would be a couple of action steps or a couple of tips that you could give a resident or a loved one or child of a resident as far as what they can do to protect their loved one or themselves from getting an infection? What are some actionable steps that they can take?
That's a good question. In respect to getting an infection, I mean, I guess, kind of as with anything else, to be a strong advocate for yourself or for your loved one, to monitor. I mean, to the extent you can. Unfortunately, a lot of residents don't have someone who's nearby, so we can't, rely on that. We shouldn't have to rely on that. That's what nursing homes and adult care facilities are meant to do. Assisted living are meant to do, is to provide that safety that a regular person can't do. But I would say monitoring. I would strongly recommend, it doesn't quite get only to infection control, but forming a family council or a resident council. Those can be very, very powerful in terms of sharing information, sharing your experiences, and speaking out in a united voice, which makes it much more likely that you'll be heard by the administrator of the facility. And certainly, speaking out when you have a concern. Filing a complaint can be useful, but sometimes it's not, because the states don't do a great job, again, in respect to oversight. But more and more we're saying, speak to your, call your congressional office, call your state legislator, and let them know.
Yeah, so don't mess around with this. What about the ombudsman? Can you just briefly explain to our injured senior community what the role of the ombudsman is? And also, I thought there was like a grievance officer also that's in every...
Oh, yes, yeah. So the long-term care ombudsman program, every single state has one under the Older Americans Act. And under that act, ombudsmen have the right to help a resident. First of all, they have the right to go into a facility at any time. They have a right to review a resident's medical records from the facility with the resident or the resident's representative's permission. And they can help, and they can oftentimes be very effective in helping residents, address some of these issues, from, for instance, whether the laundry services, if there's a problem, things aren't clean, if there's something with equipment, to care services, et cetera. If your resident isn't being repositioned or is not receiving, food that is appropriate, palatable, et cetera, that they can be a big help. Right now, ombudsmen still, as far as I know, are not going in any state, hopefully into nursing homes. Hopefully that'll change soon, but they are helping people by phone. And I know some of the state ombudsmen are doing things through Facebook, et cetera. So I would say, they can be very helpful. They can also assist in forming a family or a resident council. That's part of what they do. And then in regard to the grievance officer, that's, I'm glad that you raised that. This is something that we fought really hard for to be in the regulations, is that nursing homes now, under again the rules that have been in place since 2016, have to have a grievance officer that the facility designates as a single person in the facility that residents, families, representatives can go to if they have a grievance, and it's that person's responsibility to then find out and try to get it resolved. So it's their job to go to the administration. It's their job to go to the director of nursing, and they have to come back within a reasonable period of time with a response for you. Now, just very quickly, the facility does not have to do what you say. You know what I mean? A facility can say, it's not going to do what you asked for or to respond to your concern in the way that you want. However, and this is really important, two things have to occur. One is they have to give you an explanation if they're not going to do what you want, why, what the reasoning is behind it. And two, you can request that response be in writing, whether it be positive or negative. And that to me was just enormous. Unfortunately, that is one of the things that the Trump administration is trying to reduce. I think it's very alarming. We thought, as I said, that provision was really good. So many times we've heard from families over the years, as I'm sure you have as well, that they've complaining about something for months. They complain to this person, they complain to that person, and just not having a single person that you can go to and a structure for expecting a response and having that response in writing has been, I think, really deleterious in terms of getting residents' care problems and quality of life problems resolved.
Yeah, that's great, great information, Richard. And it sounds like that we've come a long way since obviously you had the federal law, and each administration, some administrations, when I say administration, I mean presidents, some presidents might want to be pushing for more enforcement, some less, but that is definitely something that our listeners should definitely take into consideration. At least is, the squeaky wheel gets the oil, right? Or
yes, yeah. I mean, people are afraid of retribution sometimes, and that certainly can happen. But for the most part, speaking out alerts the facility that someone is watching, that someone is concerned, and actually, as I said, earlier on, most staff I think really do want to do a good job. So, like you had mentioned our website before, we have fact sheets on a lot of resident care standards and dignity standards, and I know people use them just to alert care staff and nursing that, look, it's my right to have this. How can you help me achieve that? So, I mean, They can be used in more assertive advocacy, but they can also be used to, just knowing your rights, to let people know and to have those rights, implemented in your resident's life.
Right. Yeah, I think it's the squeaky wheel gets the grease.
I do too.
It's Friday morning. We're recording this on a Friday morning, and I'm just I'm a couple steps behind today. All right, so I want to add, Richard gave some really good action steps to take, and still we're having a lot of trouble with the nursing home industry from really implementing real reform. One thing you can also do, injured senior community, and I'm not giving me a plug, but you can also go to an attorney. And if your loved one or the resident has died or has had some catastrophic thing happen to them because of the negligence of the nursing home, they got an infection because of unsanitary conditions and things such as that, they can institute a lawsuit against that facility. And would you agree with me, Richard, that if a nursing home gets hit for millions of dollars in damages for the resident, do you think that has some effect on them implementing reform?
Absolutely. So, and that's something that we have always strongly supported is people, most people, don't want to sue even when something terrible has happened to their resident. But, our position has always been based upon everything we're talking about today, that, the rules are there and lawsuits are based upon those rules, not being, when there's a failure to implement them, that if the state is not holding and CMS is not holding Centers for Medicare and Medicaid Services, if they're not holding nursing homes accountable for meeting these minimum standards, the only way that will happen is if facilities and the industry are sent a message. And a lawsuit not only gets compensation for the harm and the suffering of that resident and the heartbreak of the family, but it sends a message to the facility and to the industry, in the community and the state. This is not acceptable. You're not going to get paid and get away with providing such substandard care.
Yeah, agreed. Richard, I want to thank you for the valuable information that you share with us today. I learned so much more than I knew already. You definitely have given our listeners some real value today, and I'm so grateful. I'm sure they're grateful as well. Unfortunately, though, we're out of time. I tell you, time flies by when you get into a good conversation and you have really valuable information to give. You just get caught into it. And I'm so sorry that we're out of time, but I'm going to have you back, and we're going to delve deeper into some of those topics. Now, if our injured senior community wants to get to these resources we talked about earlier on the website, what is the website address so they can get on there and navigate all those resources?
It's www.nursinghome411.org.
And that's obviously 411, the number 411.
Yes, 411. Yeah, nursinghome411.org. And all the resources are free to use and print out, et cetera, and share. So people are more than welcome to come. And thank you very much, Stephen. I really appreciate it. This is a very interesting conversation. I appreciate the opportunity.
No problem. What other social media platforms are you on? So if people want to kind of get the latest scuttlebutt on what's going on in the community, I know they can go to your website. Are you also putting stuff out on social media?
Yes, we have a Facebook page, Facebook.com/LTCC, Long-Term Care Community Coalition. So it's LTCCC. And we have a Twitter account, LTC Consumer, LTCConsumer. And we put out things on both of those with updates and some good information, et cetera.
Great. Thanks again. Great stuff. Thanks for being real generous with your time, and we can't wait to get you back. Injured senior community, if you have any questions about an injury you or a loved one sustained as a result of the negligence of a nursing home, assisted living facility, or other residential care setting, please feel free at any time to contact me at info@injuredseniorhotline.com. You can also go to our website, the National Injured Senior Law Center website, which is www.injuredseniorhotline.com. Also, if you'd like to audition to be a guest on this podcast, such as telling your story as an injured senior or elder, or as the child or loved one of an injured senior or elder, just email me again at info@injuredseniorhotline.com. And if you like the content that we discussed today in this episode, please head on over to the show notes, where you will find a summary of today's show and any important links, such as the link to Richard's website, the Long-Term Care Community Coalition. Always feel free to reach out to me about your own story, like I said. And please subscribe to this podcast on your favorite podcast platform and give us a rate and a review. We want to always get some feedback as to the job we're doing and how we can do it better. Thanks again for listening to today's show. Be sure to tune into next week's show. Be safe, and I will talk to you next week. Take care, guys.
Thanks for listening to the Injured Senior Podcast with Steve H. Heisler. If you enjoyed the podcast, please rate, subscribe, review, and share on Apple, Google, or wherever you get your podcasts. To find out more or to get help anytime, go to injuredseniorhotline.com or call 855-622-6530. We'll see you next time.